a number of different services for patient in the community and in Johnson County. So Johnson County is a large community and we service a large area. So this includes, of course, Buffalo and KC and places in between. We do a variety of different services. We do Medicare Home Health. Under that benefit, if a patient qualifies, we provide skilled nursing services, physical therapy services, occupational therapy services, speech language pathology services, and CNA services. We have a contract with the VA and TriWest, which is also a VA provider. We service Medicaid waiver patients, which is a state-funded program, and we provide skilled nursing services as well as CNA services under that program. We have a private pay program for maybe patients who don't qualify for Medicare and they don't qualify for Medicaid, but maybe they need assistance with something like bathing or medication prep or something along these lines. So we offer that on a private pay basis. We've been here in Johnson County since 1994. I personally have been with the department for 7 years. I'm probably the longest one there currently. We have 4 nurses, 4 CNAs, 2 part-time physical therapists, a part-time speech therapist, and a part-time occupational therapist, as well as a receptionist and a part-time social services. The number of patients varies depending on doctor referrals and things like this. We do home health as well as hospice, and so those numbers can change from time to time. I believe currently we run anywhere between 2 to 10 Medicare home health patients, 10 VA or TriWest patients, 11 to 15 Medicaid waiver patients, and 6 to 10 private pay patients probably, and we have room to grow with that as the need is there. Based under what service that we are providing, they can do a variety of different services. Medicare and Medicaid require us to provide some kind of personal care services, so these are things like bathing or helping with lotion or washing hair, something along those lines. If we did a private pay service, it could be those things as well. It could be helping with showering and bathing, but we can also add in some light housekeeping, doing the dishes, throwing in laundry, things that are taxing for patients to do in their home. But we also, our goal is to keep these patients in their home. So things that we can provide to assist with that. We're not there to take the place, of course, of a family member or anything like this, but anything that can keep patients in their home for as long as possible is our goal. I think everybody from our department brings something different to the table. Whether it's the CNAs that go in and they have just a very close personal relationship with patients, it can be pretty overwhelming and a little bit uncomfortable when we are bathing in front of somebody else and things like this. So you do have to have kind of a sense of humor, as well as just a good, compassionate empathy, because that can be uncomfortable for anybody. And so I think we provide a lot of different types of personalities when we go in. Everybody's a little bit different, but we all have the same goal in mind, which, like I said earlier, is keeping our patients in their home and independent as long as they possibly can be. Sure. Well, we of course don't share information willy-nilly. If it's something that has to be shared with the patient's primary doctor or something along those lines, we do that. If a patient maybe comes to the ER and we need to let the doctor know what that patient is on for medications and things like this, we will do that to provide continuity of care. We don't, of course, go home and tell our spouses about our patients and things like this. I wouldn't want my information out there, and we don't do that. We provide a very we provide a very quality service as well as quiet service. Yeah, I think that's a good question. One thing I like to talk to patients about is if they are, let's say, under the Medicare home health benefit, and then they are doing cancer treatments and things like this, and then they decide to stop, and we look at more of a hospice situation. One of the good benefits of having our program come in is that it's the same staff that is providing care. So like I had said earlier, it can be pretty uncomfortable having different people in your home and things like this, and so we do get to provide a continuity of care that way and continually have the same people in your home so that the comfort level is already there. Our goals change in a circumstance like that. We're no longer focused necessarily on rehabilitation or getting the patient to their max level of functioning. At that point, we're focused more on something along the lines of comfort care and symptom management. So changing that can be a lot of education and work that way, but it's the same team working with that patient and their family, which is a great benefit. So our doctor's office is right next to our home health office. So if we have, one of our requirements is that you have to have a physician here overseeing your care. So let's say a nurse goes into the home and they have a concern about a blood pressure or a wound or something along these lines. We have accessibility to our doctors right away, which is a huge benefit. If the doctor who is not there, or if the doctor who is the primary doctor is not available, we can always go through our medical director or our assistant medical director who's right there to give guidance as well. And so we have some good help with our physicians being right there and providing a good continuity of care, especially if there is any kind of concern, which I think is a huge benefit as well. I think a really good benefit that we have is specifically through our rehab department. So we share 2 physical therapists with our outpatient rehab as well as our occupational therapist. So if you come in and you happen to be here at the hospital and you're working on strengthening on the floor here at the hospital, and go home and you still need these services, the likelihood of you getting the same physical therapist and the same occupational therapist is of course very high, and so you get a good continuity of care again, which provides a comfort level because you've already been working with this team member and they're very well aware of the needs and how to get you to your max level of functioning.